How does getting a bachelor's degree in 3 years sound to you? A historic grant at Cal State San Marcos is making that a reality for students pursuing careers in mental health and behavioral health. Here now to tell us more about the SWIFT program and how it's a win-win for both students and the workforce is Jennifer Ostergren. She's the Dean of the College of Education, Health and Human Services at CSU San Marcos, and Damian Romero, a student in the SWIFT program. Thanks for making time for us today.
Of course.
First off, let's just talk about the demand. Why is this program so critical?
Yeah, I mean, I think we're all seeing coming out of the pandemic that there's a growth in the number of the need for behavioral and mental health services. And so this program is really built to help generate that workforce.
And we have what's perceived to be a mental health crisis in this country, and it's layered. It's in the people being affected, the things that are affecting them, but we're approaching crisis level with staffing for these issues, right?
Mm-hmm. Yeah, that's true. In San Diego, new predictions out say that by 2027, we'll need 18,000 new workers in this area at all levels of behavioral and mental health.
So how is SWIFT going to address this?
Yeah, it's a program, as you mentioned. It's a 3-year bachelor degree, and so it's designed for students who have an interest in helping in behavioral and mental health enter as freshmen and exit in 3 years with the skills they need to go out into a variety of different positions related to behavioral and mental health.
And so, Damian, how did you hear about it? How did you get involved?
I heard about it when I was applying to San Marcos, and I was just looking for something to keep myself busy or to get me on the accelerated pathwork. And then I saw SWIFT was offering the accelerated pathwork for the major I was going for, public health. And so I submitted my application and I got accepted.
What was attracted to you about that accelerated program?
It was really just the fact that I can get my bachelor's in 3 years, which is already a big benefit, but also the fact that they offered internships every summer to get me experienced into the fields I wanted to, with like lobbying or just public health related fields.
So why is this pipeline so important? We're bringing in people, we're identifying young candidates for it. Why is it so important to get them into this?
Yeah, I mean, one of the things about the SWIFT program is that we are actually reaching all the way back to high school and letting students have exposure to what these careers look like, topics around behavioral and mental health, and get college credit for it when they're in high school. So this is where the pipeline starts there and then builds all the way through entering as a freshman and then graduating, and as Damian mentioned, having real world experiences with internships and having access to learning more about the field and what they want to do and accomplish.
And you're exposing young people to, for many out there, they might have a perception that the mental health world is being a therapist or hands-on. They don't want to do just that. Is there a lot more to these fields than that?
Yeah, actually the two tracks that we have right now, one is a counseling track through our human development department, and you might think about that as working individually or in groups with individuals who need support in mental wellness. And then the other one is public health. You might think about that as someone who's interested, like Damian is, in influencing community and changing policy around.
Yeah, that's what I wanted to roll into. Specifically, Damian, what attracted to you? I understand you want to get into lobbying for mental health. Why do you want to do that, and how is this going to help?
My desire to get into lobbying for mental health really started with my friends from middle school to high school who all had different issues with mental health, but the issue is there's one, a big stigma behind it, and two, a lack of resources within counties, just county by county. And as a lobbyist, I plan to just kind of get, one, the word out about these type of opportunities that are limited to certain communities, and two, just to make sure their voice is represented in policies, legislation, because at the end of the day, there are programs out there, they're just not available to everyone.
We're almost out of time. I did want to ask, I understand that there was a huge grant that helped kick this off, but this program could still use financial help?
Yes, absolutely, and we're thankful for the large grant, but one of the things that I didn't mention about SWIFT is that the students are actually given resources in the summer, so scholarships, so that they can take time away from work to be able to participate, and we are always welcome to take more funding to help support the students.
Because that's where so many students catch up with their finances. They got to get a job during summers to pay for it. What an innovative way to approach this and get them into the workforce quicker. Jennifer, I appreciate your time. Ostergren, the Dean of College of Health and Human Services at Cal State San Marcos. Damian, thank you so much. Best of luck in your career. We need you out there, so thanks for doing it and thanks for sharing your story.
Thank you for having me.
All right.